Hey guys, today we're talking about a pretty nuanced subject. We're going to be talking about lower back pain. A couple of points up front. If you are over the age of 30, there is a greater than 50% chance that you have something wrong with your spine or back, be it a bulging disc, herniated disc, something of the like. Now, without an MRI, it is impossible to know specifically what that issue is. I say all that to say, even with low back issues, we can still set up a good workout program and a good flexibility program. Being that you don't know the exact issue, you're just going to have to try out moves. And when you find a move that works well for you, your body will let you know. You'll try out one of these stretches. You'll be like, wow, that feels good. I really feel that release of tension and my back feels a lot better. So let's check out some moves. I want you to try them all and incorporate the ones that you feel the most into your daily routine. Let's look at our hip reset. What this is going to do is reset the pelvis back into the proper anatomical position. Especially if you have a prior history of low back problems, sometimes muscle imbalances can cause the pelvis to get off center. Do this before every workout. It'll reset everything into the proper anatomical position and everything will flow very smoothly after that. What we're going to do is lay flat on our back. Now, what I'm doing is I'm pushing with one leg, pulling in with the other leg, but I'm going to position my hands, see my hand position here, to fight that resistance. So what I'm going to do is push and pull, and I'm going to hold that tension. Push and pull, push and pull. Then I'm going to switch. Push and pull on the other side. Switch, push, pull, and you're going to run through a couple of rounds of this. After you've done this for about a minute, we're going to grab a big med ball. You're going to put it between the knees, and we're going to squeeze it. Squeeze about 5 seconds before you relax. And then we squeeze, get about 5 seconds before you relax. Again, we're going to run through a few rounds, about a minute of that in total. You'll usually be able to feel a change in the joint, sometimes with a pop or like a clunk, when that pelvis resets back into the proper position. So again, guys, especially a history of low back problems is your number one move to do before your workout. Let's look at how to actually work the soft tissue and release the soft tissue in the lower back. So I want you to find a big ball about softball size, if not a little bit bigger. Now, the spot that we're going to position this in the low back is right at the very top of the pelvis, and we're looking to roll it kind of towards the midline of the spine here, and that's where we're going to work the tension out of our lower back. So you want to find yourself a low box. Get your feet on the box to give you a little bit more control over the pressure that you're putting on the ball. You're going to get your ball, again, right there along the crest of the pelvis. Put some weight on it. Very important. Cinch your stomach like you're going to get punched. If you don't activate your core, that can cause your pelvis to over-rotate, make low back pain even worse. From this position, you can just roll side to side, get that pressure on the ball. And for about a minute and a half, you're just going to hunt for any knots, any tension, and give that muscle a nice massage to work all the tension out of the low back before your workout. Classic stretch for the lower back, except we're going to add a banded distraction, which is going to make it 10 times more effective. So you want to loop your band around an anchor point, get some tension in it as you lie flat on your back. What we're going to do is we're going to bring up one knee. I'm going to hook the band right high on the crotch there. Now from this position, you're going to take your opposing hand, grab that knee, and you're going to open up through the chest as you actively pull that knee down towards the ground on the opposite side. From here, just relax, hold, and let the band do the majority of the work. You'll feel that stretch through the hips, all the way through the lower back. Make sure to hold this stretch long enough, a minute and a half, if not 2 minutes plus. And again, you should be able to feel when the joint loosens up and feel the change in that joint. And again, guys, all purpose, any kind of dysfunction in the hips and lower back, this one will be helpful for you.